He died with the TV still on, alone in his favorite chair, robe half open. And the cause wasn't what the autopsy said. It was a slow, invisible collapse of male health, one that thousands of older men face quietly. And the shocking part? It all started when he stopped doing something we never talk about, something that could have saved him. If you're watching this, chances are you've lived a full life, seen much, and perhaps, like many wise men, you've started to quietly consider what it truly means to age gracefully. Today, I want to share a deeply personal and often unspoken truth that can profoundly impact your health and happiness in these golden years. It's about something many of us were taught to believe we outgrow, something society often whispers should be left behind. But what if I told you that embracing this part of yourself, even in old age, is not just about pleasure, but about preserving your vitality, your strength, and your very sense of self? Hello, my dear friends. Welcome back to Elderly Life Lessons. Today I want to share a story with you. A story that, sadly, I've encountered far too many times in my 4 decades as a urologist and men's health specialist. It's a quiet tragedy, often unfolding behind closed doors, hidden from public view. I remember one gentleman, a kind and gentle soul, found peacefully in his favorite recliner. He was found alone, slumped forward in his recliner. There was no commotion, no cry for help, no signs of panic or violence, just a soft hum from the television. His robe parted slightly, a coffee mug half full on the table beside him, and a stillness that only follows the end of a long journey. The official report would say natural causes, and, medically speaking, that might not be wrong. But for those of us who work with older men every day, those of us who study not just death, but the slow fading of life, long before the heart stops, we know the signs. This was something else, something we call silent hormonal collapse, a quiet, invisible unraveling of a man's physical and emotional strength, not because of an illness, not because of age, but because of neglect. The kind of neglect that happens when men are told to ignore their own needs, to shut off a vital part of themselves, to believe the lie that intimacy, especially with oneself, no longer matters after 60. Sadly, he wasn't the only one. Every year, thousands of older men suffer the same fate, but in pieces. First, they lose their erections, then their energy. Their interest in life slowly drains, and eventually, even their will to engage, to connect, to feel alive, and what's worse, they think they're doing the right thing. They think they're being mature, respectable, even moral, by giving up what they believe they no longer need. But what they don't know is that this quiet retreat from self-pleasure can have devastating effects, not just in the bedroom, but across nearly every system in the body. Because here's the truth no one tells men over 60. When you stop masturbating, your body doesn't simply pause, it begins to break down. In this video, I want to speak directly to older men, or to those who care for them. I'll walk you through the 4 major health consequences that occur when masturbation is removed from a man's life in later years. These aren't myths or taboos. These are medically grounded realities that I've witnessed over 3 decades of practice. And more importantly, I'll share how to prevent these consequences in safe, simple, and healthy ways, without shame, without judgment. And if you stay with me until the end, I'll reveal the most overlooked effect of all, one that not even most doctors are trained to talk about, but that can silently triple your risk of prostate complications if ignored. If you care about protecting your health, your dignity, and your independence as you age, this conversation is for you. Let's begin where most men notice the change first, and often far too late. 1. Loss of sexual function. It usually begins with a small realization. A man notices he's not waking up the way he used to. Morning erections become less frequent. Spontaneous arousal fades. At first, it seems harmless, just aging, right? But then he finds that even when he tries to respond to intimacy, whether with a partner or alone, nothing happens. He waits, tries again, still nothing. And that's when the fear sets in. In my clinic, I've had countless older men sit across from me, often embarrassed, sometimes even ashamed, asking the same question. Why did this happen so suddenly? The truth is, It didn't happen suddenly. It happened slowly, invisibly, over months and sometimes years, as the body quietly responded to a lack of stimulation. Your penis isn't just a symbol, it's an organ, rich in blood vessels, nerves, and muscular tissue. Like any living tissue, it needs movement, circulation, and engagement to stay healthy. When a man stops masturbating, especially after 60, his erectile tissues begin to lose tone, blood flow decreases, oxygen delivery weakens. Over time, fibrosis sets in, the formation of scar-like tissue that makes it harder for the penis to expand and maintain rigidity. And unlike muscles you can retrain, penile fibrosis is often irreversible once it reaches a certain point. I've had men cry in my office, not because they missed sex, but because they felt like they had lost a part of themselves, something essential to their identity, something they thought would always be there. And the most heartbreaking part, it was preventable. Regular masturbation, even just a few times a week, can help maintain healthy blood flow and preserve function well into the later decades of life. This isn't about lust or addiction, it's about biology, maintenance, and self-respect. 2. Hormonal imbalance and testosterone decline. While the loss of erections is deeply personal, the hormonal changes that follow are even more dangerous because they affect your entire body. Let me take you into the life of one of my longtime patients, a retired engineer in his mid-70s, healthy weight, non-smoker, still active. But one day, he tells me, "Doc, I just don't feel like myself anymore. I'm not excited to get up. My appetite's off. My hobbies don't interest me. I feel gray." What he was describing wasn't just depression. It was hormonal blunting, particularly testosterone decline. And while testosterone naturally decreases with age, it can plummet when the male body no longer receives signals to keep producing it. Those signals come not just from exercise or sleep, but also from sexual activity. Every time a man becomes aroused and reaches climax, his brain releases a cascade of neurochemicals, dopamine, oxytocin, endorphins, that signal to the hypothalamus and pituitary, "We're alive. We still have purpose. Keep producing testosterone." But when a man goes weeks or months without any stimulation, those signals weaken. The body interprets that silence as a cue that reproduction, and by extension vitality, is no longer needed. It scales back, shuts down production. And the result isn't just sexual fatigue, it's total system fatigue. Low testosterone has been linked to muscle loss, bone thinning, insulin resistance, weight gain, cardiovascular disease, depression, irritability, cognitive fog, and increased risk of Alzheimer's. All from one simple shift that many men make quietly, thinking they're being responsible or dignified. But the truth is, dignity and health don't have to be at odds. You can age gracefully and still protect your hormonal foundation. And sometimes, all it takes is returning to a basic human need that has long been misunderstood: touch. 3. Prostate congestion and health risks. Now, this next part may surprise you. Many older men believe that stopping sexual activity is good for the prostate. Isn't it better to let it rest, they ask. In truth, the exact opposite is often the case. Let me explain. Your prostate is a walnut-sized gland that sits just below the bladder and surrounds the urethra. Its main job is to produce seminal fluid, which helps transport and nourish sperm. Even if you're no longer sexually active with a partner or trying to reproduce, your body doesn't stop producing that fluid. It keeps doing its job because that's what it's built to do. So what happens if that fluid isn't regularly released? It begins to build up inside the prostate. Over time, this can cause a condition known as prostate congestion, a little discussed but very real problem among older men. The result? Swelling, inflammation, discomfort during urination, increased pressure on the bladder, and in some cases, infection. Worse still, stagnant fluids and chronic inflammation in the prostate can create an environment that some researchers believe may contribute to the development of benign prostatic hyperplasia, BPH, or even, in rare cases, prostate cancer. I once had a patient in his early 80s who came to me complaining of nighttime urination every hour, burning during urination, and a constant pressure in his lower abdomen. He thought he had a bladder infection. Tests showed no bacteria. What he had was years of neglected prostate function. His gland was swollen and irritated, not from disease, but from disuse. I asked him a sensitive question. When was the last time he had ejaculated, even alone? His face flushed. Years, he said, quietly. I thought that part of my life was behind me. And here lies the problem. No one had told him that ejaculation isn't just about sex, it's about maintenance. Just like your heart needs movement and your lungs need breath, your prostate needs release. Regular ejaculation, whether through partnered intimacy or masturbation, helps clear out old fluids, reduce inflammation, and stimulate healthy blood flow in the pelvic region. It's not sinful, it's self-care. 4. Emotional numbness and disconnection. Now, let's talk about something even more subtle, but just as serious. Beyond the physical consequences, many men who stop masturbating after 60 report something deeper and harder to describe. A kind of emotional dullness, a slow retreat from joy, desire, and feeling. They stop laughing as much, stop engaging, stop looking forward to things. Some may call it just aging, but if you look closer, it's more than that. It's emotional withdrawal, often tied to the loss of touch, intimacy, and hormonal balance. When you climax, especially in a healthy, relaxed, non-addictive way, your body releases not just testosterone, but also oxytocin, known as the connection hormone. This chemical makes you feel bonded, safe, even loved. And guess what? You don't need a partner to benefit from it. Solo intimacy can still trigger that chemical cascade, reinforcing your emotional resilience and sense of well-being. When older men deny themselves this experience, sometimes out of shame, guilt, or the belief that they're too old for that, they slowly lose that emotional spark. They become more irritable, more withdrawn, and often lonelier. I've seen this again and again. One of my patients, a widower in his late 70s, told me after a long conversation, "Doc, I just don't feel alive anymore. I don't feel like a man. I feel like I'm fading." And the truth was, he had stopped all forms of intimacy years ago after his wife passed. He believed it would be dishonorable to continue on his own. What he didn't realize is that the emotional nourishment that comes from self-intimacy isn't disloyal, it's survival. And once we helped him reframe that truth, with kindness and honesty, his mood, energy, and even his memory began to improve. Our emotional health is tightly woven with our physical biology. Masturbation, when done with respect and balance, is one of the few remaining forms of physical self-expression that older men can engage in freely. It's not about fantasy or pornography. It's about connection to your body, your history, your feelings, and yes, your dignity. 5. Increased risk of prostate cancer, the overlooked connection. This final section is the one most men don't hear about, not because it's hidden, but because it's rarely explained well. Several major studies over the past 2 decades, including one from Harvard, have found an association between frequent ejaculation and lower risk of prostate cancer. According to the research, men who ejaculate 21 times or more per month have a statistically lower chance of developing prostate cancer compared to those who do it less frequently. The reasons aren't fully understood yet, but the leading theory is this: regular ejaculation helps clear the prostate of carcinogenic substances and reduces cellular inflammation. Now, let's be clear. Masturbation is not a guaranteed prevention against prostate cancer. There are many factors involved: genetics, environment, diet, and more. But when something as simple as regular, respectful self-pleasure might lower your risk of one of the most common male cancers in old age, isn't it worth considering? Especially since this act costs nothing, requires no prescription, and can be done safely and privately. I once spoke at a senior men's health forum, and after presenting this data, a gentleman in the back raised his hand and asked, "Are you telling me my doctor should be prescribing me alone time?" The audience chuckled, but I smiled and said, "If it keeps your heart strong, your hormones balanced, your prostate healthy, and your soul from going numb, then yes, maybe he should." The truth is, we've spent too long silencing this conversation. Older men deserve better than silence. They deserve truth, dignity, and care, especially about a part of themselves that never stops being human. So, what should you do if you've already stopped? First of all, it's never too late. I've worked with men in their 80s and even 90s who regained a sense of vitality simply by reintroducing safe, private forms of self-intimacy. It begins not with the body, but with the mind. Here's what I tell my patients: remove the shame. Masturbation is not juvenile. It is not immoral. It is not embarrassing. It is human. Full stop. Start gently. If you've gone a long time without any activity, begin with gentle touch, deep breathing, and relaxation. Don't chase performance, chase connection. Avoid overstimulation. This isn't about pornography or fantasy. This is about caring for your body. Keep it simple. Keep it honest. Maintain a rhythm. You don't need to do it daily. Even once or twice a week can support healthy prostate, hormonal, and emotional balance. Talk to your doctor. If you have any conditions like erectile dysfunction, BPH, or concerns about your sexual health, bring it up. A good doctor will never shame you for caring about your well-being. And finally, remember, your body is still yours. Your pleasure, your dignity, your wellness, they didn't expire with age. They evolved, and they still matter. To every older man watching this, or to every family member who cares for one, please hear this truth. Aging doesn't mean giving up on yourself. It means learning new ways to thrive. And one of the simplest, most powerful ways to do that is by listening to your body, honoring your needs, and refusing to let shame write your story. Your health is sacred, your life is sacred, and every part of you, including this part, is worthy of care, attention, and love. We're so glad you joined us today. If something touched your heart or sparked a new idea, share it in the comments. We'd really love to hear from you. Your words mean a lot to us and help keep this channel growing. If this video is helpful for you, please give it a like, share it with someone who might need it, and don't hesitate to subscribe. Thanks for watching, and we look forward to spending time with you again in the next video.